Good morning everybody and welcome to our webinar as part of the NHS Sustainability Day campaign. I hope you're all well. I hope it's sunny where you are and I'm glad you could join us this morning. This will be the first of the 2018 campaign. We've just come off the back of our recent awards. So we're delighted to welcome everybody to today's webinar, which is going to look at corporate social responsibility and corporate social investment. We did a survey recently around corporate social responsibility for the NHS, specifically looking at the Sustainable Development Management Plans and how it can support environmental practices. So today's webinar is going to look at some key areas, an introduction to CSR and what corporate social investment actually means, how it can be utilised by your organisation, how you can tailor it to align with both the trust or organisation business plan, but also to embed it within an SDMP, how to write a corporate social responsibility plan, and to make it an important asset. So we're delighted to be joined by three speakers today. The first speaker is Claire Igo, who is the Acting Head of Environmental Sustainability at Central Manchester University Hospital's NHS Foundation Trust. Claire and Manchester recently won our overall award at the National Sustainability Awards back in May, and we're delighted to have her on hand today. Joining Claire, we have Stacie Scullion, who's the Environmental Implementation Officer at Nottinghamshire Healthcare NHS Foundation Trust. They've been doing a lot of work around energy efficiency with her team across Nottinghamshire over a number of years, and got some great examples around CSR. And finally, most importantly, we're joined by Robert Barnard-Weston, who is the CEO and founder of Groundswell, an organisation working around corporate social responsibility and investment to support the NHS and wider health organisations. So without any further ado, I'd like to introduce Claire, who will kickstart today's webinar and tell us a little bit more about what the work they've done in Manchester and how it has supported their behavioural change work and the improvement of environmental practices. So over to you, Claire.
Okay, hi, thank you, Scott. Can everyone see my screen okay?
Yeah.
Okay, I'll assume that's a yes. Right. Good morning and thanks for the introduction. So I'm going to talk to you about our corporate social responsibility programme at Central Manchester. What we've done, a bit of highlights really, I think, from some of the key work areas that we've delivered, and then some examples from that as well. Just make sure there we go. Right, I'm on the right slide now. Okay, so corporate social responsibility. As our large employer and healthcare provider, it's our responsibility to ensure that we maximise our positive impact on the community in which we work. I think going beyond the boundaries of our sites and out into the local area and creating economic added value in the way that we do business. So how we deliver CSR has been an approach that we've developed over the past 4 to 5 years. And I'll just give you a few examples of what we do. So just to put it into context, so Central Manchester Trust is a large multi-site acute NHS trust. The trust was established in 2009 but has roots going back to 1752. And the organisation is made up of 6 hospitals across 4 main sites plus community services. And in 15-16 we measured 1.6 million patient contacts. So in terms of sites, we have large sites in Manchester and Trafford, and many of our 13,000 members of staff live locally, and we are keen that we play our part in employment regeneration and other initiatives to make the area in which we serve a better place to live, work and visit. I mean, Manchester and the area in which particularly the area where our main site is located, does face some significant challenges. In terms of health deprivation and disability, Manchester ranks at 2 out of 326 local authorities. And many of the illnesses that people suffer from the area are caused by poverty, stress, air quality, debt, loneliness, smoking, drinking, unhealthy eating and physical inactivity. Some of the local wards are some of the most deprived in the UK and have higher than average hospital admissions, cases of lung cancer, childhood obesity and teenage pregnancy. So we see, in terms of the context of our CSR programme, that can help support some of those challenges that are faced by the communities in which we serve, given the location that we're in. And we take a joined-up approach towards CSR, working with many stakeholders and agencies to deliver shared goals. So just move on to the next slide. So these are the key themes of our CSR programme. I'll talk just briefly around each one and give a few examples of the initiatives that we're delivering and what kind of partnerships we work in to be able to deliver those. And then I'll sort of finish off with how we implement and monitor our CSR plan and why it's important to us here at Central Manchester. So the key themes in which I'll talk about are community education, widening participation, environment and procurement. So in terms of community, Trust's main site is located within a innovation district known as Corridor Manchester, just south of Manchester city centre, and that area includes the Oxford Road corridor where we're located. The area altogether, Corridor Manchester area, covers a workforce of 60,000 and 243 hectares. So the Corridor Manchester organisation supports a number of collaborative projects across the region, including innovation, carbon reduction, transport, health and wellbeing, employment culture, smart cities and wayfinding. And many of the areas covered by that partnership are cross-cutting. So the Trust is an active member of this partnership. We have nominated representatives on the main board for Corridor Manchester as well as on some of the subgroups. One of the corridor themes is transport and access. The Oxford Road corridor where we're located has recently been transformed as part of Greater Manchester's bus priority package, which includes guided busways from north and west of the city, with the main road outside the hospital site being closed to general traffic. So we worked very closely throughout those works in a partnership with Transport for Greater Manchester and with other local organisations to ensure that scheme was delivered with minimal disruption throughout, and that we kept staff and visitors informed of various road closures and disruptions. And now that scheme has been delivered, it does have benefits for everybody. So staff and patients that live in the areas that are served by the new bus routes can get to work a lot easier. Air quality is improved for local residents. We also work very closely with the local universities to deliver packages of sustainable travel support. So just yesterday we ran an annual cycling event with the universities, and that's a focus of activity for all of the cyclists in the local area. We also work very closely on things like negotiating better discounts for staff with local bus providers, and the sorts of activities we can get a lot more benefit by working in partnership rather than each organisation trying to do it on their own. The Trust is a member of the Local Health and Wellbeing Board, and that brings together NHS, Public Health, Social Care, Children's Services and elected representatives to plan health and social care services across Manchester. Our chairman sits on this group, and the focus of their work plan is all about community and improving health and wellbeing. As a foundation trust, we have nominated and elected governors who take an advisory role in the running of the trust, and then some of the subgroups on which those governors run are things like patient experience, corporate citizenship and staff health and wellbeing. Trust has an active volunteering programme. Volunteers can support patients to find their way around the hospital, as well as supporting specific teams and activities. And then once a year the Trust, well, I think more than once a year, but there's a big event once a year where the Trust opens its doors at the annual members meeting, and that helps to showcase what the organisation is doing to the local community, as well as communicating the Trust's performance. And again, it's all part of us being seen as part of the community in the local area. So in terms of education, which it's another one of the key themes of our CSR programme, we sponsor Manchester Health Academy, which is a centre of excellence for healthcare and sciences located in Wythenshawe, which is just to the south of Manchester. We're the first trust to be a lead sponsor of a health academy. So what the trust is able to do through that sponsorship is to provide a range of opportunities for young people to learn both in the classroom and the workplace, and potentially open up opportunities for those young people, and about careers that within the health sector that they may not have been aware of. So staff from the Trust regularly present our temp support events. We offer sixth form placements as well. Elective treatment centre, fracture clinic and paediatric unit are examples of where we've been able to offer placements. The Trust works in partnership with the school to run annual health days, and then in 2015 supported the school with winning a Healthy Schools Big Health Challenge. 8 students took part in a campaign to reduce consumption of energy drinks, and a number of other enterprise challenges. So the Trust's widening participation programme benefits the organisation in a number of ways. It helps us to offer a more inclusive employment process and benefit from a diverse workforce that represents the communities in which we are based. This is also a key message of the NHS 5-year forward view, and it's widely understood that within healthcare, a diverse workforce that is representative of the local communities ensures a better understanding of patients' needs. So in terms of where our staff live, we know that 11% of our staff live within central Manchester and 87% live across Greater Manchester. So we offer regular open days for young people to find out about career options in healthcare and talk to staff working in those areas. We run a clinical pre-engagement programme which offers a live work placement as well as a guaranteed interview and 3 weeks of accredited classroom learning. Another programme that I know has been really successful at Trafford General Hospital site is the supported internship, and that helps young people with learning disabilities to gain work experience, a nationally accredited qualification and ultimately paid employment. And then we also offer a range of apprenticeships and work experience placements as well. So our environmental programme has been, we've developed our first Sustainable Development Management Plan and got that approved in 2014. And the SDMP focuses on carbon and cost reduction through efficiencies in the way that we manage our resources that we use in the delivery of our activity, with key themes: energy, water, travel, waste, behaviour change and communications. So we have an action plan that sits within the SDMP, which gets updated. I mean, it's a live plan really, but we report externally through our annual report on an annual basis, and then internally there is a governance structure which includes, so there's a governance corporate citizenship working group, and then we also have a sustainability steering group as well, with various subgroups that sit under that, and representatives on that will include estates, PFI partners, clinical leads, and departments like informatics, procurement, capital programmes. So there's good representation on there from departments across the Trust. A key part of the way that we deliver our environmental programme is staff engagement. We have an active communications programme using internal channels such as things like newsletters, notice boards, TV screens and social media. And then a big part of our programme has been the Green Impact programme that we're now into our 4th cycle of delivering. And Green Impact is a sustainability behaviour change programme where staff work in teams or departments to deliver sort of manageable bite-sized sustainability challenges and then report back progress on what they do through an online workbook. The last round of the programme that ended in January this year, we had 29 teams complete that programme, and we're sort of well into our next cycle now. And then the other aspect of our environmental programme in relation to CSR, I think, is probably accreditations to provide assurance to people that we've got external assurance on what we do as well. So recent examples of that are that we've accredited, the Trust has been accredited to the Investors Environment Management System, and we also have been awarded with a Travel Choices Award from Transport for Greater Manchester as well, around the way that we deliver our sustainable travel programme. So the last strand our CSR programme is around sustainable procurement. Our procurement team is already shared between Central and South Manchester in anticipation of the merger that's scheduled to take place later on this year. So I've just mentioned a couple of the things that they're involved in. The department very closely monitors SME spend and sets targets in terms of increasing that spend. So some of the ways in which we can support increased working with SMEs are to ensure prompt payment. So they pay 80% of SME invoices within 10 days, as well as ensuring that we pay 95, at the moment the stats are that we pay 95% of all invoices within 30 days of receipt. Procurement department have supported a number of stock rationalisation programmes across the trust estate, and it's very much an approach where they say that relationships with suppliers can be owned by departments, and a good example of that is we had an example last year where the theatres basically looked at the packs and saw that they were getting, there was items in the packs that were never being used and were being thrown away. So they've done this across a number of the adults and children's theatres and eye theatres, where they've been able to get those packs more closely matched with what the needs of that department actually are, and that's helped reduce wastage as well. And again, that's been done by giving ownership to departments there as well. And then another example is the War Pit reuse programme that procurement have been very active in supporting and saying to departments, you must look and see whether or not we've got these items available internally first that are unwanted from another department before you go out and buy new. So in terms of how we would see CSR, to sum up the benefits that we see from having a CSR programme, we are in an environment where we're faced with increasing intensity of activity and rising cost of resources. So obviously, the efficiency and cost saving elements of that is very important, and that will support us with reducing our carbon footprint as well. We can ensure that we're compliant with obligations that are on us as an organisation in terms of things like Social Value Act. Helps with our reputation as well, and staff experience, and where we have where we're able to go out and engage with the local community, have patients represented in our governors and other groups, then that gives us an opportunity to have a much improved patient experience as well. So I think, just to sum up, in terms of making CSR an asset to the organisation, I think the key for us is to communicate what we do and engage. And I think since we started looking at this, what we've realised is that it's not necessarily about creating new streams of activity, but it's about communicating what you're already doing and kind of joining the dots up a lot more between what you're doing, maximising the relationship that you have with stakeholders as well, and just making it part of everyday business. So I think that wraps up my presentation. Happy to take any questions either now or at the end of the other presentations. Thank you.
Thanks very much, Claire. Yeah, I think as you just touched on there on the final slide, it makes perfect business sense to join up the dots.
Yeah.
That's what corporate social responsibility does. I just want to make it notified to our attendees that you can, there should be a button where you can kind of wave your hand, so to speak, and put forward a question. I've got some questions that I'll put forward to all three of the panellists at the very end. So what we're going to do now is move on to our second presentation from Stacie Scullion at Nottinghamshire Healthcare Trust, and Stacie is going to talk a little bit more about what Nottinghamshire have done in relation to the CSR.
Okay, thank you, Scott. Hope everybody can hear me okay. My name is Stacie Scullion and I am the Environmental Implementation Officer for Nottinghamshire Healthcare NHS Foundation Trust. Now, my role is in the Energy and Environment team, which sits within our trust-wide Estate and Facilities Directorate. In this presentation, I'll outline how we, as a team, incorporate corporate social responsibility into our practices through our SDMP, as well as how we promote CSR through corporate social investment and behaviour change. Now, I'll just give you a brief overview of our trust so you understand our responsibilities a little better. We are a major provider of mental health, intellectual disability and community healthcare services for the people of Nottinghamshire and its bordering counties. Now, our trust employs around 9,000 staff across multiple sites to provide integrated and coordinated care and support to the 190,000 people who use our services every year. We also provide secure mental health forensic services, as well as providing the healthcare service in prisons across South Yorkshire and the East Midlands. Now, this slide shows our team's main responsibilities within our trust-wide SDMP. Now, our responsibilities within the SDMP fall into three main categories: core, reputational and discretionary. Now, as you can see from this diagram, our core responsibilities are required to ensure our trust meets its environmentally, legal and regulatory requirements. Our team also manages our trust's reputational responsibilities. And although these aren't our core obligations, they are required for tendering a stakeholder, as well as maintaining our CSR reputation. Our discretionary responsibilities make up around 10% of our workload and are justified through our CSI approach. Now, of course, CSR is at the heart of our SDMP, which identifies, prioritises and monitors the actions needed to improve the sustainability performance of our trust whilst reducing our carbon footprint. Now, incorporating CSR and CSI into our SDMP was made much simpler by using the basic CSR hierarchy model, which is shown here. Oh, sorry about that, the side bits are going a bit fast. Having our responsibilities within our SDMP, go back to that one, already categorised as shown in the previous slide, we were able to easily associate them with each stage of this hierarchy model. Now, just to explain a little how we use this model to ensure we incorporate all CSR requirements into our SDMP. Now, looking at the bottom segment of the hierarchy, the fundamental component is economic. This literally means to be profitable. Now, obviously, we are a non-for-profit organisation, but we are still expected to be profitable. Now, our team analyses our waste, energy and water usage, which often finds discrepancies which are resolved quickly, often with financial savings. Our team also tenders for energy, water and waste contracts. We keep costs as low as possible whilst ensuring our environmental obligations are met. Now, a great example of where CSR was involved in making our trust more profitable is a large-scale energy project at our largest site, Rampton High Secure Hospital. Now, 5 years ago, the hospital's heating and hot water were supplied via a coal-fired boiler house. This equipment was not only carbon intensive, but also inefficient and nearing the end of its working life. We researched, project managed and installed an energy centre consisting of a CHP unit and a biomass boiler. This was the most cost-effective and sustainable solution to the needs of the site. The new energy centre not only reduced carbon emissions by a huge 56%, but made significant cost savings of 44% on what would have been the cost of the energy for the old boiler house. Now, the next component of the hierarchy is legal. All of our core responsibilities, as described in the previous slide, fit directly into this legal component. It is our team's fundamental responsibility to ensure our trust activities meet environmentally legal standards, policies and regulations. We regularly attend groups to share sector best practice with other public bodies, including Waste and Sustainability NPAG, HEFNA, doing it again, sorry, and the SDU. Now, these meetings are so useful in ensuring that we are up to date with sector legislation and we keep abreast of any upcoming changes. We also subscribe to Cedric, an online legislation portal which helps to simplify environmental legislation and sends us automatic alerts to our dedicated email inbox to inform us of any upcoming policies or amendments. And this is a really useful tool. The third section of the hierarchy is ethical, and this is where our reputational responsibilities within our SDMP fit. Our reputational responsibility is not only ensure that we are fulfilling the SCR requirements of our SDMP, but make our trust more attractive when contracting new services or obtaining external funding for sustainable improvement projects, for example. The most significant example of our ethical approach to CSR is our ISO 14001 accredited environmental management system, which our team directly manages. Now, CSR is at the heart of our EMS, and not only is it great for our trust reputation, but it's also a great tool to help manage and audit our responsibilities within our SDMP. Our trust procurement policy actually has an entire section dedicated to ethical and sustainable procurement. Now, we've got a really great relationship with our procurement team and consult with each other regularly. This is hugely beneficial for each of our departments to fulfil our CSR obligations within our SDMP. Now, we also have to ensure that our trust activities are not just detrimental to the local community. We work in collaboration with our communications, HR and wellbeing teams to manage and promote several sustainable travel and transport schemes to reduce air pollution arising from our activities. These schemes include our low emissions pool cars, cycle to work, discounted public transport, and we also have emissions caps, these cars too. Now, the top of the CSR hierarchy represents philanthropy, and this is where our desirable or discretionary obligations fit, and what we classify as the corporate social investment in our SDMP. Now, unfortunately, being a public sector organisation, we cannot be philanthropic in the literal sense. We do, however, help our local community in other ways. For example, our team facilitates and promotes quarterly collections for local food banks. Now, despite being able to gift financially to our local communities, our trust provides both long-term inpatient and outpatient services to nearly 200,000 people across the East Midlands. Now, these service users are our community, and it is our CSR to not only reduce the environmental impact of the services we provide to our community, but to ensure the overall environment at our sites is beneficial to their mental health, well-being and recovery. Now, this is especially important for our long-term inpatients residing at our secure forensic units, as we are their community, and it is our obligation as a trust to ensure that our patients have access to green spaces and activities as close to those they would encounter outside of our care. As leaders in the UK for mental health services, we recognise the well-documented research into the positive effects that usable and accessible green spaces have on mental health, well-being and recovery. Our team works closely with occupational therapy, health and well-being and recovery teams across the trust to give both hands-on and compliance support with green space projects. Now, while we are responsible for ensuring that CSR is at the heart of our SDMP, we also need to ensure that our colleagues across the trust are aware of its contents and requirements. In order to do this, we have a dedicated and continuous engagement and communication plan in place. Now, as a small team of 5, it would be incredibly difficult for us to reduce our trust's carbon footprint and overall environmental impact without a little help. In 2015, we set up our award-winning Green Champions Network. This network of like-minded staff allows us to disseminate information across our trust. This has proved to be an invaluable tool, especially when it comes to putting our CSR and CSI approaches into practice. Now, alongside our Green Champions Network, we created an environmental calendar, which hopefully you can see in this slide. Now, as you can see, each month we dedicate our communications to a specific environmental concern from our SDMP. We chose the subject of each month to coincide with national campaigns. For example, this month we focus on travel and transport. This coincides with National Bike Week, and by pure chance, Global Action Plan has set their National Clean Air Day campaign to take place in June, which relates perfectly to our usual June promotion of our sustainable transport initiatives. We also write a monthly e-bulletin, and there's a few examples just to the right of this slide, and that's sent out to our Green Champions for them to disseminate to their colleagues. The bulletin informs staff about our current CSI initiatives and projects across the trust, encourages readers to take part in and promote our campaigns, and informs of any legislative or policy changes too. However, when it comes to engaging with our wider trust colleagues about sustainability or implement new waste procedures, for example, we have to plan and facilitate behaviour change campaigns. As no doubt you are all aware, behaviour change is not always well received. Engaging with colleagues about healthcare waste segregation or encouraging them to leave their cars at home and commuting sustainably is not a straightforward task. Now, when it comes to engagement and communication of CSR, behaviour change is our biggest hurdle. We encounter 3 common responses to behaviour change. What's in it for me? Now, people aren't very forthcoming when it comes to changing a process used to, or signing up for initiatives such as car sharing, or taking the time to register for things such as our reuse portal Warpit. They feel they are taking time out of their already busy day for little or no personal benefit. What's the point? Now, we've struggled quite a bit with misinterpretation of certain procedures across our trust, mostly regarding the correct segregation and disposal of waste. The common misconception being that it's pointless as it is disposed of with general waste or incinerated anyway. Now, this is very frustrating when trying to improve recycling or implement the offensive waste stream to our site, for example. We haven't got time for any extra work. Now, getting the message across that change means to adapt a process already in place rather than add to their duties is also a common response. Now, our jobs would be a million times easier if all of our colleagues had the same attitude to behaviour change as our 4-legged residents. Now, these guys are always the first of our colleagues to get involved in our campaigns. Gizmo, Walnut and Enid are our biggest fans, and they make promotion a bit more fun because they always send us photos like this. Now, behaviour change in practice is never straightforward, as you all know, especially with an NHS trust where people's roles are so varied. We have learned a lot of the time through trial and error that our approach to behaviour change must be adapted to its specific audience. Our hotel services colleagues who deal with waste every day, for example, require a different training approach in a new procedure to what our nursing or admin colleagues would need. We've found that targeted behaviour change campaigning works really well. Each winter we run an energy challenge where we choose around 15 individual sites and analyse their energy use for 3 months in line with a targeted energy saving behaviour change campaign. We provide each site with weekly reports on their energy usage throughout the challenge and also have a league table which encourages competitiveness. This approach is always successful and actually gives us results which we can use in reports about energy savings. Now, our most successful campaign was actually our simplest and least time consuming. When promoting our low emission pool cars during a recent winter campaign, we literally put posters on the back of toilet doors. The interest and new registrations from this approach really surprised us, and we cannot recommend this simple yet effective approach enough. This actually has led us to consider how we can apply this approach to behaviour change campaigns in the future. Now, while we found that incorporating CSR and CSI into our SDMP was very straightforward, it is not so easy communicating its objectives or expecting our colleagues across the trust to be proactive in their approach to any changes. Now, I've mentioned throughout my presentation that we collaborate with other departments. This is so valuable, particularly this month whilst promoting National Clean Air Day, where we involved our communications and HR teams from the very beginning. Because of this, our campaign has not only been promoted trust-wide via our intranet homepage, but has featured across all of our social media platforms too. Communications really are your best asset for getting your message out there. Now, we don't know everything, and we certainly don't get it right every time. We've learned that a one-size-fits-all approach to behaviour change is not always the best approach. Whilst adapting our CSR campaigns to target a specific audience takes a lot more preparation time, this time is justified as the campaigns are much more effective. Found that while one-off behaviour change campaigns to promote CSR are great, people soon lose interest. Now, having our environmental calendar allows us to revisit each environmental concern within our SDMP every year. Embedding behaviours essentially leads to a system that is consistently successful, ensuring that corporate social responsibility becomes sustainable in itself. Right, thank you very much for listening. I'll hand you back to our facilitator.
Thank you very much, Stacey. That was a fantastic presentation, I must say. I really enjoyed that, and I like to see both the pyramid examples of corporate social responsibility and investment and how that works in Nottinghamshire, but I've also just tweeted the image of your calendar, which I thought was absolutely fantastic, showing how you work across each month and how you embed that across the departments, which I think is essential to this. So fantastic presentation. We're going to move on to our final speaker, Robert Barnard-Weston, who is the founder of Groundswell, who have been working with the NHS and healthcare and wider for a good number of years around social responsibility investment. So it's over to you, Robert.
Thanks very much, Scott. Just going to try. Is it my screen on? In which case I should try and make it full screen.
It is on, yeah.
Okay, thank you. Okay, I'm not much of a geek, so bear with me, guys. It's not really doing what I want it to. I'm happy with that as it looks. Is that okay for everybody?
If you press this screen button at the bottom down there where it's sort of slideshow, you should have a little, just next to the 4 square dots, just a bit further up onto your panel, actually on the presentation slide, a bit further up, PowerPoint, not that one. You can just see it looks like a start of a slideshow. Nope, onto the, and just a bit further down where your cursor is, you can start a slideshow, and that would be the best way to do it for you.
Hang on, I think we may have just found it. Hang on, no, I've done something terrible.
We can see that anyway, Robert, that's absolutely fine.
If you can see it, I'll go with that, because, you know, I'll just make a mess of things otherwise. Believe me, I do that a lot. So I'm going to keep, just so everybody knows, this slide deck isn't one I'm going to speak to in detail, as in go through every point on every slide, because it's actually a slide deck which we created for our first NHS Foundation Trust client 2.5 years ago, when we were designing the bootstrap model. It's been added to over those 2.5 years, and I'll be talking about the updates as we go through. But the main point is to send people this slide deck so they've got the detail and they've got like a colour by numbers, you know, self-funding with change way of doing CSR and CSI in any healthcare organisation, actually, whereby they end up with it costing them nothing, indeed usually providing change, as I say, and where we're demonstrating that in the early stages, that's looking very good. And so you'll be able to sort of read off these slides and then put them to use. You don't need us involved at all. Obviously, we're happy to help anybody who wants help, but I'm hoping this is kind of like a DIY approach for people who want to take that approach. And we're already hearing, today's 2 presentations are great examples. We're already hearing some fabulous progress being made by people up and down the country, and nowhere more so than in Notts and Manch, both of which delight me. So background, we all know this story. You know, we've seen major cuts in public sector spending, not least because of the global economy situation and the crash we suffered in 2007, 2008. Therefore, we have increasing social problems, including health, and people get upset about this. It costs more right across the public sector to deal with increasing social problems, and then you suddenly find that you're in a downward spiral. That's what this slide is talking about. And as we say at the bottom, however, could this be an opportunity to achieve a breakthrough rather than a breakdown? And in the process, we hope, avoid the breakdown. So Bootstrap, as everybody knows, no doubt, although one of the board members of East Kent Hospitals University NHS Foundation Trust did say to me over lunch a couple of years back, what exactly is this bootstrap model, Rob? It's bootstrap, and it's about lifting yourself up with your own bootstraps, of course, an image which explains succinctly the idea of a self-funding program with change. So not wishing, as I say, to speak to all the points in here, what we originally did with East Kent hospitals when they asked us to develop a CSR/CSI model for them was to say, and I've heard both Stacie and Claire say today similar things, what are we already doing? And how could we join up the dots? Stacie just used exactly that phrase a few minutes ago. How can we get better return on investment from the things we're already doing? How can we improve, and how can we fill gaps and have more dots in which to join in order to make a more cohesive picture? Where do we need to make significant improvements? So engaging people who are really interested in this stuff, both within among the NHS employees, but also among all the other stakeholder groups, the patients' families, local NGOs, and of course, obviously, as has again been mentioned, looking at what Simon Stevens has been saying, how do we engage with public health? And within the local authority? How do we engage with social care? How do we engage with police and probation? And when addiction services get involved, you can have significant improvements whereby, and we've worked on projects in these areas with the private sector and with the charity sector, not least, for instance, in Burnley, where cutting addiction problems was a way of also cutting the need for people to mug and burgle to fund crack cocaine habits, and then fewer mugging victims turned up at A&E, and the heat was turned down slightly on the A&E overload. So all these things have to work together, and it's been great to listen to people talk this morning about places where exactly that is beginning to happen. So I'll move rapidly on. We looked at the return on investment with our, if you like, our demonstration trust, where we were testing out this hypothesis that we've been using, I ought to say at this point, since the late 1980s in the public and third sectors, and in the private and third sectors, and in some public sector applications, albeit not within the health economy. And I'll touch on other public sector as well as private and third sector applications of this sort of thinking and action in a short while. But what we found was that there was an enormous amount of return on investment not being achieved, and of course that's why the term corporate social investment, I coined that term initially for the private sector, but talking about the private sector investing in society, because when anybody invests in society, particularly those that are well funded, and often the private sector are better funded than the public sector, sadly, we're hoping to help to improve that balance. Society has a habit of paying back. She's rather keen on being invested in. So what we found was there was a fragmentation. It was a little bit ad hoc. It wasn't informed by an overarching strategic plan. Few people had the means to measure return on investment. They didn't know when they were successful, and even when they did, they didn't know how successful. So we worked on metrics. We've been working more recently with the Centre for Sustainable Healthcare, of course, in Oxford. Rachel Stancliffe has joined up with us in applying their considerable experience and skills in developing metric systems and funding research to demonstrate the hard economic truths that we face and the hard economic benefits we can achieve when we take these sorts of measures and then measure the outcomes to prove the effectiveness of the programs that are being adopted now. But, and again, we've heard Stacie and Claire talking about the communication, the vital nature of the communications disciplines. Fundamental. We have an integrated communications, we call it the integrated corporate social investment communications model. It's a bit of a mouthful, but it combines internal with external comms, as you'll see in the slide deck when we send it around. It combines interpersonal with media-based comms, and it turns monologue into dialogue. We don't just say, here's a plan, it's going forward. We say, if you were interested in a new plan to deal with whatever it might be, head of femur breakages among the elderly with blood pressure problems and renal challenges, what would that look like? Let's talk to the patients, let's talk to their family members, let's talk to the carers who are helping them to avoid these problems. Find out in dialogue what's wanted and what isn't wanted, and act on that. And so, and it's an evolutionary, iterative system of communications where the dialogue informs the next round of engagement. That round of engagement then provides data and in both numbers and narrative form, and then that informs the next round of deliberations as to how we can evolve the system and make it even better. And then we go back out into action, and then we ask people, okay, so what do you want done differently now? We then ask people, what did you think of what we did then, and how can we build this into a well, my favorite word, of course, is groundswell, and it's a sort of crescendo of improvement based on what everybody wants and what everybody doesn't want, and improving the one, and we hope eliminating ultimately the other. So I'll move on quickly here. So how can a return on investment be improved? There are a whole lot of, and this deck has a lot of examples of how these things can happen. And we have had opportunities over the years since we founded Groundswell in '89, which is so what, 28 years now, to working with the private sector clients with whom we've developed some of these models on public sector engagements. I'll give you one brief example right now, actually, if I may. We were asked by the Prince of Wales through his charities to address urban poverty in 5 or 6 significant urban poverty areas in the UK. The first one being Burnley, where there's some really serious problems. We've worked all over the world. We've worked in post-Civil War and during the Civil War in Uganda. We've worked in various other parts of the world where you might think that poverty and deprivation and, you know, atrocities and so on are as bad as they can get. Actually, urban poverty in Burnley, I've got to tell you, in some pockets we found was worse than we'd seen during the Civil War in Uganda. And that might sound shocking, but that's because it is. So that was funded by the ASDA Foundation, and without dwelling on the, you know, the detail of the thing, just to give you a couple of top line examples of how effective that was, by their standards, relatively minimal investment. The ASDA Foundation funded a program in which we engaged with 38 infant schools and brought in not only the year 3 kids in food growing programs, kids who had been born with ADHD off the scale because they were born to crack addicted mamas, in some serious urban poverty areas where all these associated problems were very, very acute. And to cut a long story short, and a story that I'd love to tell everybody in great detail because we're so proud of what happened, ADHD was dropped massively, some say on the metrics that are available, by as much as 90% within 2 years. Ineducable children became very much educable and very, very high achievers. Intergenerational communication and collaboration was encouraged, and drug addiction issues were reduced among the teens leaving these schools, the older siblings of the kids we engaged with initially. With the grandparents who'd been out to grass since the mining industry was shut down in the 80s, those who were still around became fitter and more self-confident and felt more useful in the community as they taught their grandchildren how to double dig a vegetable plot in the school playground or in raised beds and a corner of the school playing field where they still existed. The savings to the public sector were colossal, and I'm talking police, probation, the things we mentioned about muggings and A&Es. At one point, and I'll end this little example on this one, when the grandmas said, we're going back to bingo because it's safer on the streets now, the teenagers aren't out there mugging for their money for their crack habits because they're working with their younger brothers and sisters on this farmers market at the school gates, we knew we'd made a big difference. The grandmas were pleased, so we were very pleased. And the Prince was pleased too and wants us to go forward into 4 or 5 more urban poverty areas with this. And of course the health economy benefits massively, so it's far from unconnected to what we're discussing here today. Not wishing to go into all the detail on these slides, you'll all get the chance if you're interested to read them through. You can see in the 3rd bullet point there how many stakeholder groups can be brought in, and we've worked with all these stakeholder groups in various different projects over the last 3 decades. And I'm happy to share the outcomes with anybody who wants to get in touch with specific questions or ask them later in this session. So as we've heard, again, from both Claire and Stacie, the key is joining up the dots. I don't need to dwell on that point right there more than to say that's exactly what we need. Well said, ladies. I'm delighted to hear people already acting on that hypothesis and getting results. It's fantastic. And by the way, I want to come and see both of you and get these case studies down. We've been very lucky to be advised in recent times by Fiona Daly, who's also done a fabulous job when she was at Barts. Of course, she saved £9.2 million with her CSI engagements. She's now doing fabulous work with Aquafund and taking no strings attached grant money to public sector bodies, very much including other NHS trusts, and helping them with water saving. And she saved 1.8 million, of which 1 million was rolling annual savings at Barts by using that same technique. And now she's taken that fabulous message and those fabulous free funds out to all the other NHS trusts. And anybody who isn't biting her hand off for that Aquafund money should do so. But yeah, we've been working with her on understanding how she joined up the dots at Barts. And it's a similar story to what we've been hearing from Stacie and Claire today. You know, she got fantastic results and the health economy benefited enormously. And when this story goes nationwide, you know, you three, I think, Stacie, Claire and Fiona, are going to be the, I don't know what you're going to be, the queens of sustainable CSI NHS strategy and tactics. And I can't wait to see that get rolled out nationwide. So what are the, you know, the areas where the main benefits accrue? There they are. We've heard about employee engagement. I lead the, some of you may have heard about the Engage for Success movement, which has been backed by 4 successive British Prime Ministers. So it's not a party political thing. Everybody wants it. There's 28 billion of improved commercial opportunity for the private sector through employee engagement. There's terrible problems with employee engagement, as we know, in the NHS because, you know, it's underfunded, everybody's stressed to the max off the scale, and it's very hard to avoid, you know, anger, frustration, and especially in vocational areas like the NHS. It's even more acute because people want to heal, they want to help, they want to give, they want to take care, and they're struggling to do so because they're massively under-resourced. And this program is designed to help solve some of those problems. Elder care, one of the most costly areas that we're facing. We've got some fantastic stuff, which again I'll happily answer questions on now or at any other time, which can save, quite literally, we've got a £600 million saving based on a report just in the last 6 weeks of much more cost-effective elder care. I'd be happy to introduce anybody to the people behind that study and indeed to the program of active engagement, which we have at our fingertips now, and we bring private sector investors to fund a lot of this stuff, I ought to say right now. We're trying to use the private sector to avoid privatization of the healthcare system. So when you bring in a sporting goods company to fund the you know, walk talk, facilitated walk talks that some trusts are already involved in, whereby, you know, everybody from the age of 3 to the age of 93 gets to go on walks which you know, themselves help with seeing off the dangers in pre-diabetics of type 2 diabetes. They're also taught by these trained facilitators funded by the sporting goods industry how they can use nutrition and other lifestyle choices to make sure they don't become diabetic, they don't end up having to suffer from amputations, they don't end up causing huge suffering for their family members and friends and neighbours, and all of it funded by private sector partners in win-win engagements. So again, you can see from that list that the areas where the most important gains are achieved, and all of it in this bootstrap model is self-funding, and sometimes self-funding, as I say, with change. So it's basically these 3 stages. They're not really stages, they can happen simultaneously. Quick wins, pretty straightforward really. Wastewater, energy, transport and food are the ones we are engaging with already with our NHS clients. And it's not hard to save a huge amount of money, as we've heard from Claire and Stacie, and Fiona will tell you, you know, her story too, and it's the same story. If you just get a bit organised and you just get a bit thoughtful and you bring in the people who know what they're talking about and the people who are really passionate about making a difference. We're talking about some very, very passionate people here among, you know, the 1.4 million employees of the NHS. They're equally passionate, many of them, about these things, though I do take the point that Stacie made about the, you know, what's in it for me, what's the point, and it's just more work. Well, if the answer to that, of course, as Stacie, you've already proven, and so's Claire and so's Fiona and so are we, is that once you do find you've freed up many millions of pounds more to actually do what you really want to do, which is to heal more people and prevent more people from getting sick or damaged in the first place, that's the point. And people are catching on, I'm delighted to say. But yeah, there's a lag and still a lot of people tearing their hair out who can't hear this message, but we'll get to all of them in the end. win-wins. I've talked about a few. We're working now with our NHS clients with naming no names, but giving you a bit of a hint, the world's largest pharmacy retailers, to improve the problem in primary healthcare, primarily, of people having to wait a month for a GP appointment. So if you can go into a branch of a pharmacy on the high street and get yourself a retired GP trained and funded by that private sector partner, and get the key health checkpoints done right there, blood pressure, blood sugars, BMI, and so on, and a referral that day to a consultant if you need one, and prescription on the spot from either the pharmacist or a retired GP, suddenly people aren't going terminal with their incipient cancer problems or whatever they may be, and the heat is taken off the primary healthcare sector, which of course is something they desperately needed. So that's a brilliant win-win, and we're already engaged in that one. And I'm pleased to say that that's a national rollout. It's already beginning as I speak, and we've already agreed with the private sector partner in that case, and indeed the NHS partner in that case. This is not a pilot. This is the first phase of a national rollout, and we want to get every NHS trust into this, and we want to fund similar engagements in all their communities, so primary and therefore secondary, because of course when somebody does go terminal or critical or has an awful disaster happen because they couldn't get to the GP and something much worse happened, something developed into a much worse situation, they ended up in A&E or they ended up being blue lighted to hospital when they didn't need to be, then it costs a fortune to the local health economy, which it didn't need to. If it weren't for the pressure on the primary healthcare sector, then that wouldn't have happened. And this private sector partnership is taking that heat off and providing the funds to do so at no cost to the NHS partners. Primary, secondary, tertiary, public health, social care, mental health, all of them are beginning to see that this is a powerful win-win opportunity. And pioneering wins are longer term. We've already got, because we're eco-entrepreneurs, as well as being consultants to governments, to multinational corporations, to national and international charities, to supranational organizations. We work with the OECD nations together on urban sustainability. We work with, as you've heard, Uganda. We're getting into a program on renewable energy in Senegal right now. So we've got quite a lot of experience on all scales, in all sectors in this stuff. We've already got quite a few social and eco-enterprises of our own that we've launched to demonstrate that these are, we understand how to make these happen. One of them is a renewable energy company, which turns, for a 16,000 population town, all its food waste into its own energy, and provides opportunities for shareholding among the citizens. It's not injected into the grid, it goes straight back to this town, and we're going to try and put one of those in every NHS trust as well. So the food waste of all your patients, and I hope soon non-patients, because they didn't get sick in the first place, their food waste at residential level as well as within the hospitals can become their energy, and they can own the company that does that. There's an enormous amount of opportunity in pioneering wins like that, on-site farms and all sorts of other similar engagements, funded again by the quick wins and the win-wins. So there's no net cost, and in some cases no cost at all, even up front, to the NHS partner. So I'm going to leave it there because I think I've whittled on long enough. These are some details which you can all see as and when Scott, Matthew and the team send around these slide decks. You'll be able to see what the example win-wins, pioneering wins and quick wins are. I don't think there's any need for me to do more than simply say a lot of it focuses on this dialogue process, and the goal groups, as you can see on that slide, are the key to that dialogue. Happy to talk to anybody at any point about that or any of the other issues that have been raised in this brief and rather manic ramble from me. Thanks very much, you guys.
Thanks very much, Robert. Thank you for that. Yeah, there's Robert's slides along with Stacie and Claire's will be available to everybody after the presentation. Hopefully by this afternoon, Matthew will send them out. I want to thank all three panellists. I know we're just overrunning slightly, but I do want to put a couple of questions to all three of you actually. One of the main one is, we talked a lot there about corporate social responsibility and engaging with staff and comms and teams and how we do it. Do you believe, or were there examples of a financial benefit to reinvest in frontline services that can be gained from CSR. I'd just like to put that firstly to Claire and say, from your perspective, have you been able to demonstrate effectively if there is financial outcomes and rewards to such CSR work?
Hi Scott, and hi everyone. Yes, I think I can speak more from the perspective of, I think, delivering the environmental sustainability programme, because that's what that's what I'm more familiar with. But we keep a tracker of every single scheme that we deliver as part of our environmental programme, so that we can log, investment and cost savings, and I can certainly pick out, individual examples of schemes where we can show that. I mean, Warp is quite a good example, because that platform actually measures those cost savings for you, so we can log in at any time and get a live figure that says, at this point in time, you've saved X amount through reuse of equipment. So I think, something like 80,000, I think we're on at the moment for that. So that's pretty good. Again, schemes where you've made a tangible investment and you can measure a saving, that's really easy to do, like with any of your energy management schemes. I think there's definitely a little bit more work to be done around the, perhaps around some of the other areas and around some of the sort of wider CSR initiatives. Much as things like, the employment programmes, I wouldn't be able to say to you right now that they have saved us this amount of money. I'm not sure that we measure everything that we need to measure. I know they certainly measure, progression and that kind of thing. But yeah, that, I suppose, yes, I think I could in a lot of aspects, yes. Yeah,
but the same over to you, Stacie. Have you got any kind of examples you could quickly give us, that sort of points to that, where you've seen financial savings, whether it is the SDMP or relative to the CSR aspects?
Well, yeah, like Claire, we also have Warp It. It's one of our few paid-for initiatives, so to speak, but Warp It actually paid for itself within about 2.5 months of its implementation, so it's really, really good portal. I don't know, when campaigning for things like increasing recycling, for example, it's hard to measure financially, but once it becomes successful and people start upping their recycling, we can actually swap external general waste bins for DMR bins, and of course it's nearly half the price to dispose of. So as schemes like that roll on, we actually get to see financial savings from behaviour change campaigns, like recycling.
Yeah. Robert, from your previous experience, where do you feel that the opportunity quickly lies within, for instance, environmental aspects? I know on one of your slides that I've seen around East Kent, you showcasing there you've done some work around that environmental aspect. From your side, is there some, outside of obviously the stuff with ADSM, is there some real other areas that you think there's some quick wins there in terms of CSR for the likes of Claire and Stacie?
There are, and in fact, you're quite. I mean, as we said, the fact we've got legacy, engaging on the wastewater, energy, transport, and food, we've heard from all three of us now, is a major area for quick wins. Engaging with estates and facilities management, and indeed procurement on these things, is a fundamentally important thing, because it is where the quick wins can be gained. The legacy buildings portfolio, for instance, from the early days of the NHS, and even the more recent construction. We've worked with Scullion on since the 1990s on sustainability in PFI construction projects, and it's amazing how much improvement can be achieved. And I could get into detail, I won't now, but I could get into detail again with anybody. We've saved many, many millions, both for the NHS trusts themselves and for the construction partners in PFI projects doing those things. But an example that I love also on this, which is more kind of like where the social side links up, of corporate social investment specifically, is the one I made very brief reference to earlier, where on elder care. We're talking to Nike at the moment, and they're really keen on this sort of thing because it's their CSR budget doing something measurably useful. This report I made earlier shows that the 6 weeks of physical training for the over 60s prior to elective surgeries has been measured as knocking a significant chunk off the recovery times for those people. Now, Tim Cook, who is a very eminent anesthesiologist and has been advising us on some of this work, actually explained to me, as a consultant anesthesiologist, he said, I know that there are 3 million elective operations a year in the NHS, 2 million of them are on over 60s. A lot of those, we all know, are hip replacements, knee replacements, with quite significant recovery times even today, using the more modern techniques that still require a lot of recovery time, recuperation time. He said this 6-week training program, especially when funded by a private sector partner like Nike or any of the other sporting goods companies, if it only knocks one recovery day off the time spent in a hospital by those patients post-operatively, and only in the over 60s, which is 2 million of the 3 million elective operations per year. That's a £600 million saving across the NHS. Do the maths, that's a big saving for every trust that does that. And it's not hard because it's paid for by Nike or a company like them, and it involves sending trainers in to these elder care patients prior to their surgery for 6 weeks to do some fairly simple strength building exercises which will enable them to recover more quickly and suffer less pain and be back with their families and up and running again and happy and healthy. Quit more quickly and saving 600 million for the healthcare economy in the process, which I think is pretty damn good metrics.
Yeah, fantastic. Well, thank you very much, Robert, and thank you, Claire and Stacie, for joining us today. I hope it's provided benefit to our attendees to talk a little bit more about that. We will be having a lot more information around this as we go forward, including the recording of this and the slides available, and we'll be able to send over any information, put you in contact with Robert, Stacie or Claire in relation to any further conversations you wish to have around this and how we can work more collectively. Just to give you a bit more information about the upcoming campaign, we will be kick-starting in early October. We'll be going over to Wales in November, Newcastle in March, and University of North Midlands Hospital in middle March, with the day itself on the 22nd. We're also going to be announcing some information soon about some areas we're going to be covering, including a leadership panel, which will feed into the campaign regarding support from those leading the NHS, such as Claire and others, and how we can work more collectively to engage with other trusts and hospitals who may not have the environmental practices in place, and how we can work more collaboratively. And we will be launching our impact report again in early October. So I'd like to take this opportunity to thank Stacie, Claire and Robert once again for your time today, and I look forward to seeing a lot of the people and the attendees in the future at some of our roadshows. Thank you very much.
Thank you, Scott. It's been a joy.
Cheers. Thanks, guys. Bye-bye.
Thank you.
Thank you.
Bye.
Bye.